My name is Jonathan Rossiter. I'm a consultant ophthalmologist, or otherwise known as an eye surgeon, based in Taunton in Somerset. My final area of expertise is in glaucoma management. Glaucoma is a condition where the pressure inside the eye builds up and causes slow, irreversible damage to the nerve at the back. It affects about 2% of the population over the age of 40, and that rises to about 10% at the age of 90. And if you have a family member with it, your risk is quite higher, and it is recommended to see an optician every 2 years, and those tests would be free from the age of 40. Thankfully, glaucoma treatments have improved extensively in my career. The condition itself is actually the second commonest cause of blindness in the world, but thankfully in this country, most people will be picked up early, and with early treatment, regular monitoring, it is extremely unlikely that blindness would ever happen. Occasionally people can lose their driving license, which is obviously upsetting, and that's why it's important to have an early diagnosis and regular monitoring. The treatments have, as I've mentioned, really significantly improved in my career, and we're now able to offer a very simple laser treatment as the first line. So that's known as selective laser trabeculoplasty. This is a cold form of laser applied to the cells that naturally drain the fluid out of the eye, just stimulating them to work harder or rejuvenating them. It's not burning or making any holes. Patients can even drive themselves to and from this appointment, which is available here at the Nuffield. It only takes 5 or 10 minutes per eye. The eye typically just feels a bit light sensitive or achy for a day or so. It's highly effective and can avoid the need for any drops, but on occasions it does wear off and need repeating, and some people will end up needing to have eye drops. I estimate about 80% of my patients will be managed well with just laser and eye drops, but about 20% may need some form of glaucoma surgery. And again, thankfully, we've had some fantastic additions to our treatment options for glaucoma surgery, two of which I've introduced here at the Nuffield. The first is known as iStent. This is the smallest implantable medical device and is a very tiny titanium stent which is implanted best at the time of cataract surgery and is placed into the drainage angle of the eye to encourage the fluid to drain out through the normal pathways, bypassing the cells that are no longer working for aging and genetic reasons. And it's very effective in lowering the pressure. We can even often reduce the number of drops that are needed afterwards and avoid the need for further interventional surgery later on. Some people's glaucoma will remain uncontrolled, and we may need to consider further types of surgery. Preserflo is also available here at the Nuffield, and this is a biocompatible, tiny implantable tube which is placed underneath the upper eyelid and in between the sclera of the eye and the conjunctiva. The conjunctiva is the loose skin that covers the eye, and the fluid drains through underneath this layer, forming a reservoir which controls the pressure and stabilizes the vision. Surgery only takes 30 or 40 minutes, and it's a great improvement over the traditional filtering operations such as trabeculectomy, which are very old-fashioned.